Hi, today we're going to go over pediatric math. The calculations for pediatrics is going to be very different than what you've been used to when you've been doing calculations for the adult medications. The biggest difference is that there is not a consistent dosage all the time. For adults, if you need to have medications, just everybody gets the same, 250 milligrams or 500 milligrams. In children, it needs to be calculated on each individual child based on their weight. So the first thing I'm going to go over is what we call safe dose range or safe dose calculations. The first thing you have to do when you're calculating the safe dose for your patient is you have to make sure that their weight is converted into kilograms, because all of the dosaging is based on kilograms. So first of all, you want to go pounds and change it to kilograms. First that you're going to do. Then you're going to need to check your reference, and that can be your micromedics, it can be a drug dosage book, it can be a medical book, as long as it has pediatric focus. So the next thing, you're going to check your book, your reference, for the safe dose recommendations. Now on the medication exams that you're going to be doing, I will give you what the reference will state as a safe dose range. For instance, it may say something like 50 to 100 milligrams per kilogram, and this part is important to differentiate. It may say per 24 hours or per day. That means this range is good for that child to have for the whole day. Now it may be divided in multiple dosages. Again, on the reference it'll say 50 to 100 milligrams per kilogram today divided by 3 dosages, or given QID, or given 3 times a day. That will tell you how many dosages you'll have to calculate for this child based on that. Okay, and we'll go into that a little bit. So you need to make sure that when you're checking the reference, you look at this part. Sometimes it'll say 50 to 100 milligrams per kilogram given Q 6 to 8 hours. So this will say that this is each dose. So the dose would not matter how many doses you give, the dose is going to be this much. This is what you will see in things like ibuprofen, Tylenol, Lasix, sometimes digoxin. So you need to make sure that when you're looking at the safe dose range that it tells you milligrams per kilogram, and then you have to decide, is it for the whole day or is it per dose? So that's important for you to differentiate when you look at that safe dose range. Okay. So we're going to take this first one, and let's say we calculate our child's kilograms to be 5. So it's a 5 kilo child. So what you're going to need to do is calculate what his safe dose is going to be. So I'm going to multiply 5 times 50, that's 250, 5 times 100 to 500 milligrams per day. So this is the dose that this child, this 5 kilogram child, can get per day. If you then want to know how many doses you're going to get, where do you go to find how many dosages the child can get? You have to go back to the order, what the doctor has written. So if the doctor has written the dose to be 300, this is the order, order, 300 milligrams TID, okay? That's what the doctor has ordered, 300 milligrams TID, 3 times a day. So now I've calculated out my safe dose range for this 5 kilo baby. I'm going to go back and compare it to what the doctor has ordered. Now this is where you have to make a decision how you want to do this. You can do this one of 2 ways. One is you go back to the order, you look at 300 milligrams given 3 dosages per day. So the total amount this child's going to get for the whole day is going to be 300 times 3, 900 milligrams for the day. Then you're going to compare this number to your safe dose range calculation. As you can see, the safe dose is 250 to 500 milligrams per day, but the total dose the doctor's ordered is 900 milligrams a day. If it is outside the range that you have calculated, this dose is unsafe. and you will write unsafe dose. Okay? If it is too low, if the calculation you came up with is 200 milligrams, it's below the safe dose range, we consider that unsafe. So on the exam, when you're going to calculate this and you're going to make a nursing judgment whether the dose is appropriate for the child or not, you will say it is unsafe. It falls below or above the range. Make sure you understand that. The other way you can do this, some people find it's not easy to do. I have 300 milligrams 3 times a day. That's the single dose. They go back here and then they divide 250 by 3, which is, I'm going to have to do this like this. This is 8, 3, so it's 83.3, okay? And I'll have you, what we'll do is, I'll explain that later about kilogram. So it's 83 to 3.3, and then 500 divided by 3 dosages. 7, 6, 2. So it's going to be 166.7, because we're going to round this up. We're going to round that up to 0.7 milligrams per dose. So either way, whether you're going to do it this way where you total up the whole amount of milligrams you're going to have per day and compare it to your all-day range, or some people prefer to do it per dose. They can do 300 milligrams TID, compare it then now to the dose, per dose range that you came up with, and you'll still see that it falls above the safe dose. So you're going to answer that it's not a safe dose. Now sometimes on your exam, it will say calculate the single dose range. Now when it says single dose range, you have to do it this way, okay? Unless it says, if it doesn't say single dose range and just say safe dose range, it's talking about the per day or whatever is recommended by the reference. Okay, so the other thing I want you to remember to do, on my exams, I have you calculate your kilograms to the nearest tenth. So if you're changing pounds to kilograms and you get 5.33333, you're going to calculate it to the nearest tenth, which will be 5.3. The other thing that you're going to do is when you get to your final answer, you're going to calculate it to the nearest tenth. And the only reason for that is that we all come up with the same answer on the exam. In real life, it may not make that much of a difference, but for testing purposes only, you need to round up to the nearest tenth. That way I know that we all get the same answer. So number 1, round your kilograms to the nearest tenth, and then you round your final answer to the nearest tenth. Okay? So that's calculating safe dose ranges in children. You will be getting a lot of these questions on your exam. Calculating safe dose range might be for the day, or if it says single safe dose range, then you're going to show me what the dose is. Okay? If you have any questions, go ahead and email me. Otherwise, you can talk to your clinical instructors who will also be able to help you with that. Okay? We will then go and discuss in the next video how to calculate maintenance rate and also how to calculate urine output for children.